New research from the University of Toronto shows that racialized and Indigenous Canadians are far more likely to have multiple medical conditions than other groups. And this places them at a much higher risk of severe implications from COVID. With more, I want to bring in the author of the study, Shen Lamson Lin. He's a PhD candidate at the University of Toronto's Faculty of Social Work. Good morning. Welcome to our program.
Good morning, Marcia. Thanks for having me.
First of all, why did you want to do this study? What gave you the idea?
Yeah, so we know that COVID-19 outbreak is not affecting everyone at the same level. And actually, the pre-existing multiple chronic condition has been linked to social inequalities for decades. So in the current context of COVID-19, I'm very curious to understand how one's income, education, race, and immigration status combine to shape their health and illness among the older population in Canada.
So, hypertension, diabetes, obesity, among some of the most common conditions. What did you find when looking at these groups? What did you conclude?
Yeah, so my study is using a population-based data, and I actually compared around 1,000 racial immigrant to 300 indigenous population with around 23,000 Canadian-born white. And what I found is that South Asia immigrant, Black immigrant, and Aboriginal Canadians are around 2 times more likely to have 3 or more medical health conditions. But when I look at bringing in an intersectionality lens, that when I'm not looking at race alone, but in addition, income and education, what I found is that these racialized groups with disadvantaged socioeconomic backgrounds are close to 4 times more likely to have 3 or more medical health conditions.
And that makes those people more vulnerable or more likely to get COVID.
Exactly. This is because this 9 medical condition that I selected has been identified as clinical risk factors that are associated with severe illness from COVID-19 infections. And this actually will require hospitalization, the use of ventilator, and intensive care use.
What would you like to see done with your research?
I would like to say, first of all, given the lack of social demographic and race-based data in the Canada health system, it is very important for us to realize that to collect the race-based data at first, and my research provide a timely evidence for the health policymakers to reconsider measuring upstream social inequalities in health. And then second, I think it's more importantly that we should have policy response. And the current government is doing a good job in terms of providing, expanding social welfare program, for example, Canada Emergency Response Benefit. But the thing is, this kind of programs and benefits are mainly geared towards working age population that are laid-off workers and businesses. But for the older population, it's very important. We only have one-time COVID-19 payment for the seniors, but it's actually not enough. And we should expand more social welfare programs for the seniors. For example, increasing the old age security pensions, guarantee income supplement, and even providing more subsidy for this drug prescription for those who have underlying medical conditions.
It's really important work that you've done. I can't believe you're just a student. We can't wait to see what else you're going to come up with. Shen Lamson Lin, he's a PhD researcher at the University of Toronto. Thank you for doing this, and thank you for sharing your research with us this morning.